Good morning, everybody. uh, my name is Pam Taylor. I'm president of the board of the Sustainability Alliance. And I'm so glad to have you all here at OSU Tulsa. And for those of you joining online, we appreciate you joining. We're really glad to have everybody here for our first business-to-business case for sustainability for 2024. Today's program is about the intersection of mental health, employee retention, and sustainability. Again, thank you all for joining us today. This program is near and dear to my heart. I was on the wrong page, so I'm sorry. So just let me be the first person to say that mental health matters. And we are really grateful to be having this conversation with you here today. The topic of employee well-being and its impact on retention and recruiting, it's been coming for a long time, and I'm glad to see it more in the focus. It's becoming really important in the built environment, which is where my line of work is. And we see a lot of it coming in the as we address the needs of frontline staff, patients, and we do that by providing access to nature, daylight, and offstage areas for staff and employees to seek respite and decompress after what can be stressful interactions in their day-to-day. At this time, I'm going to invite up Corey Williams, Executive Director.
Thank you so much, Pam. Appreciate you all being here, and welcome to the B2B. And okay, so before we get started, if you'll take just a moment, we have a QR code up there on the screen to take a survey. It's important. It's an intro survey. It's important for us to be able to continuously improve the experience for you. So just take a quick moment and do that. Thank you all. And now I'm going to take a picture of you all doing that. That's fabulous. Thank you. Okay. So before we also get started, I want to acknowledge our board members that are here today. So when I call your name, if you'll please stand. So Pam Taylor, who you just saw, please stand again. Richard Cox, Connor Carroll, Emily Mortimer, Lindsay Barbour, and I saw Ann Money there. So give them a round of applause. We're so glad to have them here. These events would not be possible as well without the support of an incredible Sustainability Alliance team. Jill Maud, who welcomed you in, Morgan Fairley back there doing her magic with the PowerPoints, Missy Lukenbach there, our First Steps and Community Coordinator, and our newest team member, Sunny Lee, is here with us. She's our Development Manager. We are so delighted to have them all with us today, and make a point to connect with them. Also, our newest support team members and interns are Bethany Johns, Emily Vickers, Salvador Segovia Jr., and Janae McCrae. Please give them all a round of applause. I want to take a moment also to thank our business sponsors, some of our business sponsors here for the B2B Case for Sustainability series, the Oklahoma Department of Environmental Quality, the Oklahoma Secretary of Energy Environment, One Oak, Spirit Aerosystems, Explorer Pipeline, and Williams. We're extremely grateful for all their support of all of our sponsors. And I also want to thank OSU Tulsa for helping to host today's event, and Dewberry as our refreshments host, and specifically want to thank Monica Collington with OSU for helping to coordinate, and Pam Taylor with Dewberry for your support. Let's give them a round of applause. So the Sustainable Alliance mission is to provide communities with tools and resources, and in the three areas of sustainability: social responsibility, economic vitality, and environmental stewardship: people, profit, and planet. And one way we help to support you is through our sustainability journey on different programs like the B2B Case for Sustainability series, which we're hosting today with wonderful speakers and moderators. And it's an opportunity for members to not only visit with and learn from our distinguished guests, but also with each other. I heard several of you interested in different kind of recycling programs or energy programs, and this is the network for you. So it's a great opportunity for you to connect. So join us today and support B2B as a member. There's a QR code, I think, up there, and if not, we'll see it in a little bit. But the B2B is also an opportunity to introduce you to Scorecard. And Scorecard is our online sustainability tracking assessment tool for organizations who want to improve their sustainability and their activities using the triple bottom line strategy of Scorecard. It engages organizations around 3 areas of sustainability: that people, profit, and planet. And the holistic approach to sustainability allows organizations to engage their employees, bolster their economic growth, and become better environmental stewards. I was just visiting with someone and in the back there, we were visiting about one of our first B2Bs that we had just down the hallway about 10 years ago. And she was sharing that she's still using those same practices today that she learned. So I'm loving hearing that. We track national and global trends when it comes to our Scorecard program and the B2B, such as ESG, the environmental social governance reporting, diversity, equity, inclusion, materiality, and circularity. So reach out to Morgan Fairley there. She can help you with Scorecard if you want to get started. And if you are a Scorecard member, just raise your hand so we have a sense of how many Scorecard members are in the audience. Yay, I'm so glad to see you all here. Thank you for your leadership. And actually, this is a great time just to acknowledge our 2022-23 Bellman winners. They were selected by a panel of judges to award our Scorecard members that have achieved sustainability excellence in their category. So for micro, ES2, for small was Cherokee Nation Environmental Programs, medium was Cox Communication here in Tulsa, large was Spirit Aerosystems here in Tulsa, and our overall Bellman winner this year went to Aon. So let's give them a round of applause. Thank you. The Alliance also manages several other programs such as First Thursdays, Green Drinks, TerraScore. So please come by the Sustainability Alliance booth afterwards to learn a little more. And if you have questions for our moderator today and our guests, please send your questions via text to 918-808-6576. And we hope to get those toward the end of the program to our panelists. So the intersection of mental health and sustainability and employee retention, that's why we're here today. And Sustainability Alliance continues to review our own tools and our own programs around aligning those 3 pillars, again, of people, profit, and planet. And the Sustainability Alliance incorporates its healthy workplaces within our Scorecard program. And we did that from the very beginning because we knew it was really important to the health of any organization. And we kicked that off in 2015. But since that time, we've continued to refine items and educational support along those avenues. Several years ago, we added diversity, equity, inclusion items into the Scorecard tool, and now they're required as part of the cornerstone aspect of the program. During the pandemic, it was also clear and important that, became important that mental health was an issue for our members and their organizations. We offer a program through First Thursday encompassing access to nature and parks to get them outside through our First Thursday program. Right after the pandemic, we said, here are ways to manage your mental health, do something that's good for the environment and good for yourself, and that's getting outside. This was a needed aspect for our community, and I'm sure many of you can relate to those longer walks than you used to do, perhaps, and walking your dog more, those kinds of things. But getting outside and having access to nature is really essential, and we'll probably hear a little more about that today. When our members of the community are feeling supported and healthy, then we can count on a better community for all. So today, that's what we want to talk about. So with that, it is my complete pleasure to introduce our moderator today and friend, John Schuman. Dr. John Schuman is the Executive Medical Director of Oak Street Health and Network of Primary Care Clinics for Patients and Medicare. For a decade prior, he served on the faculty at University of Oklahoma's Tulsa campus, and he frequently appears as a radio host with KWGS 89.5 FM public radio for Medical Mondays. Please welcome Dr. Schuman.
Hi, everybody. Good morning. And thank you so much, Corey, and to the Sustainability Alliance team for putting so much hard work into planning this, and to OSU Tulsa for hosting us here. And to those of you, there's a couple dozen of you, I understand, online watching this on Zoom. So thank you for both being here or tuning in on Zoom. I'm delighted to help facilitate a panel on this topic. And Corey, as you heard, I'm sort of I call myself a reformed academic. I'm in the private sector now. And so don't do as many of these speaking opportunities as I perhaps used to. So it was a real flattering and an honor for Corey to ask me to do this. But it's a topic that's very near and dear to my heart, to talk about mental health. And we have a great group of panelists here today to share some thoughts with you and answer questions, both from me, but also from you. So if you have questions or as they arise, feel free to text them to that number you saw on the screen. But I'm pleased to introduce our panelists. First, going to my left and down the row, we have Aisha Jefferson, who's the Corporate Communications Manager with the Quick Trip Corporation, and we'll hear her story. We have Dr. Sarah Coffey, who is currently the Chair of Psychiatry and Behavioral Health at the OSU Center for Health Sciences. And finally, we have Zach Stoikoff, who's the Founding Executive Director of the Healthy Minds Initiative, an incredible organization, which you'll hear more about. And so I wanted to open things up by asking Aisha to tell us a little bit about Quick Trip and mental health for Quick Trip employees, because as a B2B session here today, we want to think about, you all are business owners or work in businesses, and we want to think about, how we treat and retain employees, how we treat them well, and in the hopes of hiring and retaining them, because we know a happier workforce is a more productive workforce. So Aisha, how many employees are currently at Quick Trip?
Quick Trip, we currently have 31,000 employees.
31,000. And this kind of flabbergasted me, but how long have you worked at Quick Trip?
21 years.
21 years.
Yes.
It's kind of hard to believe. Okay, tell us your journey, your Quick Trip journey. Like you told us 21 years ago you started, but you're not originally from Tulsa, but you've lived here for a few years. Tell us a little bit about your journey at Quick Trip.
So I'm originally from Atlanta, Georgia. I started my career there. I was in college. And of course, when you're in college, your parents cut you off magically. And I said, I have to get a job and I need to get a job quick. I passed Quick Trip one day to get gas on my way to college, and I was blown away by the customer service. They were like, hello, welcome to Quick Trip. I was like, wow, okay. I said, I want some of that. So I filled out an application. Next day, received a phone call, and I said, thank you, parents, for cutting me off. This was probably the best opportunity I've ever had in life. And 21 years later, here I am.
And that's amazing. And you have worked your way up. I mean, so
Yes.
you're now at corporate. So that's not always an opportunity available in every company, but Quick Trip is pretty famous for being one of those great places to work. So share with us some insights about what makes Quick Trip such a great place to work. And then I'll ask you more about like mental health for employees.
So I started as a part-time clerk. 21 years ago. I was in school for mass communications. And magically, I didn't know that selling hot dogs would lead me to this path. So I was a part-time clerk for about 9 years. And then I had a store manager that kind of tapped me on the shoulders one day and said, hey, we're more than a gas station. And I said, what do you mean by that? I'm in school, doing my thing. I had a side job doing communications in Atlanta. And he said, well, we have opportunities in Tulsa, Oklahoma. So one day you could potentially go there and do what you went to college for. I said, no way. Sell slushies and hot dogs. You're kidding me. He said, absolutely not. So that's when I began my career and my journey at Quick Trip. I started as a part-time clerk. I worked my way all the way up through the chains. I was an assistant manager, store manager. And before I left Atlanta, I was a supervisor for 20 locations. And then I got the call that we had an employee retiring, and that was my opportunity to move to Tulsa.
Wow, congratulations.
Yes.
Aisha, how does Quick Trip is pretty interesting in terms of how it handles employee benefits. Can you share a little bit with us about that?
So we actually have our own benefits program. So we facilitate our own hospital, which is called Quick Med, and that's for all of our employees. So once you have worked with us with the the period of time that qualifies you for benefits, you have that opportunity to have access to those benefits. So it's called Quick Med. We, like I said, have our own insurance and our own benefits program, and it's really great for us.
So you have this kind of in-house benefits program that provides, health or access to health care, health opportunities. Let's focus for a second on behavioral health. Is that an added part of the benefit, or how? And I think you also have a specific sort of carve out for behavioral health, right?
Yes, we have our employee assistance program. So that's facilitated for all of our employees outside of our benefits plan. So our employee assistant program, it allows our employees to have 5 free sessions based on their specific diagnosis. So anything that they're dealing with, and it can be from the simplest thing to the most difficult thing that they're dealing with personally or professionally. So.
And you mentioned 31,000 employees. Any idea like what the uptake on that utilization is? Like how many?
It's close to 10%.
10%.
10% of our employees utilize our employee assistance program.
Wow. Okay. Excellent. I'm going to come back to you, but thank you for that introduction. It's
You're
terrific.
welcome.
Dr. Sarah Coffey, great to have you here, kind of on home turf,
Yeah,
if you
I know.
will.
Thank you. I got my orange.
You really do.
Good.
So you, from the purview of an academic clinician, physician who's involved statewide with lots of initiatives around mental health, one of the challenges that I both read about and have experienced personally is just in terms of like really everybody. And I serve now a geriatric population mostly, but I was going to focus more on young people. But coming out of the pandemic, there's just been sort of a real perception of a rise in diagnoses of anxiety and depression. And I know you've been integrally involved with how the state or the educational institutions are addressing mental health. Can you share some wisdom with us on that?
Yeah, absolutely. And I think, unfortunately, even prior to the COVID pandemic, mental health issues were pretty common. Unfortunately, we're often not talking about them as much. There's still a lot of stigma around mental illness, but important to know that it really can impact all of us, if not individually. Certainly a family member or a friend might be struggling with a mental health disorder. However, during the COVID pandemic, as you mentioned, we really saw a marked increase in mental health disorders across the age continuum. So for children's to adolescents to adults. And I think you'll see back here too, this actually is representative not only of the United States, but also Oklahoma. Upwards of 45, 50% of individuals were indicating that they were struggling with symptoms of anxiety as well as depression. So certainly it is something that is really impactful. In preparation for this panel discussion too, I was looking at some of the data, and depression remains one of the leading causes of disability worldwide. Economic impact, $1.5 trillion a year whenever people aren't able to come to work, or if they're coming to work not perhaps as productive. So it is really an important thing that we need to address as a community as well as individuals, not only for the moral imperative of taking care of each other, but also because of the impact that it has on the community overall.
Thank you. I wanted to ask you a follow-up on sort of remote health, because you have sort of an expertise in with Project Echo and doing, and you can explain what that is if you wish to. But the pandemic, we saw a tremendous rise in the advent of telehealth, and I was wondering, we've seen a lot of like venture capital go into like development of these companies that do like sort of online mental health counseling. Do you have thoughts on that? I mean, in terms of the efficacy or prevalence, and I mean how it's impacted like your work at OSU or your colleagues?
Yeah, absolutely. So, I mean, I think first of all, we know Oklahoma is a rural state. And so unfortunately, oftentimes expertise is in the urban areas. So telehealth is really important. And a lot of the data that's out there indicates that it's equivocal to other care that you might find if patients are just coming to see you in the office. So really do think it's important and part of the continuum. The other thing I'd add too, though, is that certainly we want to make sure that people are treated appropriately with evidence-based care. And that's where our models at Echo, being able to provide specialty services to primary care across Oklahoma, is really important. Because what I often see as a clinician is that a patient might have a diagnosis diagnosis of anxiety or perhaps depression. We spoke about kids, even kids, it can take up to 10 years until they're having symptoms, until they're accurately diagnosed and actually retreating symptoms and treatment, which is really problematic. But also too, I often see a lot of what I might call under treatment. So individuals are receiving services, but perhaps they're not in remission and are not getting much better. So really focusing on that treatment to target, making sure that people are really meeting their goals and that clinicians are providing evidence-based care to make sure that they're getting where they need to be is really important.
So I wanted to ask one more thing to you, at least here at the outset, which is just that as a department chair, you oversee a faculty, you have residents, you have students, and speaking from sort of inside the sort of the medical establishment, I know there's a lot of stress and a lot of burnout in the profession, and that's not unique to medical professionals, but it's something that's very well publicized. What kinds of steps are you taking, or is OSU taking, to try to alleviate or mitigate some of that stress for your trainees, your healthcare professionals?
Absolutely. And I want to give a shout out to our wellness team back there. You guys want to raise your hand? Oh, and Dr. Chin, raise your hand too. She's one of our residents, so she's
Oh,
here.
great.
But as a formal medical student at OSU as well, I think OSU really emphasizes the importance of belonging and well-being amongst our medical students as well as our residents. There's several initiatives that are going on at OSU to ensure there's a wide variety for students to feel safe and to feel that wellness is a priority. We were just speaking previously that wellness looks different for different individuals and for different communities. What might work well with the medical students might not be the same for faculty. See our HR representative here, Tina, as well, who I often learn from as well, the importance of promotion and education and support. The other thing too, John, you mentioned in the kind of healthcare workforce, what we often see is that the administrative burden is what really contributes to burnout. And so a wellness initiative might look different with medical professionals as opposed to residents and trainees. The other thing that we noticed too, OSU has our Help for the Healer Echo, which was actually a partnership with the Department of Mental Health. As a healthcare professional myself, that often identifies as the helper or the healer. Quite often we notice that we don't put ourselves first. We so identify with helping other people that we often don't prioritize our own well-being. And so we're now in our 4th year of our Help for the Healer Echo. We're really pleased that we got funding from the Tobacco Settlement Initiative to continue it because it was so well received throughout the community to make sure that we're highlighting that all of us in our professions might need different things at different times to support our own well-being.
Thank you so much.
Yeah.
So before in our our warm-up session here, I learned from Sarah that the residency program here at OSU went from an entering class of 6 psychiatry residents to 8. So you've actually increased the size, which leads me to our next panelist, Zach Stoikov, who's the founding executive director of the Healthy Minds Initiative. Zach, you describe Healthy Minds Initiative as kind of a backbone organization. Can you tell us what you mean by that?
Yeah, the way that I could describe what Healthy Minds does, I'll paint a little bit of a picture for you. The road to mental health care in America and certainly in Oklahoma is not really a road at all. It's a winding, convoluted trail of cow paths going in all different directions. And some of them you run into barriers, and some of them are roads with blocks or potholes. Some of them lead to very unfortunate places like jail or death, all while trying to get mental health care. And so what we do at Healthy Minds is we try to straighten out that road. We try to widen the highway and create the appropriate on and off ramps so that we can get appropriate mental health care. That's another way of describing systems change. And as a backbone organization, we facilitate problem-solving, outcome-oriented groups that work across the state to strengthen the continuum of behavioral health services for Oklahomans with policy change, with community change, and with leadership.
So the prior question or comment really to Sarah about the growth and the size of the residency class, I know one of the things you're looking at this session is to try to increase the number of mental health professionals in the state of Oklahoma. Can you tell us a little bit about those efforts?
Yeah, I think it's important for attendees to realize, and Dr. Coffey mentioned it, that the mental health crisis facing America and Oklahoma certainly is a generational issue. It is the perhaps defining healthcare issue of our time, I would argue. The critical lack of mental health professionals is one major part of that. We are simply lacking the people who can help meet the demand that exists today. During the height of COVID, in about 2020 to 2021, the survey data indicated that about 1 in 2 Oklahomans was experiencing some diagnosable mental health condition, which could include a substance use disorder of some kind, anxiety, depression. And so often those go undiagnosed. And you know very well that depending on the diagnosis, it could take 6 to 10 years to get a diagnosis, depending on what is going on with you. And in that time, your brain is being damaged. And in that time, you are potentially in confronting with all the ways that that road can lead to bad places, such as jail, death, things like that. And so one of the critical things that we need to lay a foundation here for this road is the professionals. And what we're doing this year, Healthy Minds is really working at the state capitol to improve the number of professionals. And we've proposed a package of bills that make it easier to become a mental health professional. So social workers, I'll give you an example. By the data we have, meet about 67% of the need for their profession in Oklahoma right now. We have one of the strictest requirements for becoming a social worker in America. In Oklahoma, we require 4,000 hours of licensed, before you become a licensed clinical social, 4,000 hours of supervision. The national average is more like 3,000. So you can make more money as a social worker in another state and do it in a lot sooner. And our people at the OU social work program will say, yeah, we're losing people to Kansas, Missouri, all the time it happens. So there's that component of it. And then we've got to strengthen the training pipelines. What we've found in Oklahoma is that we are graduating people with degrees. The degrees are not the problem. It is the training after your degree that you are required to take before getting a license. That is the problem. We don't have enough psychiatric residencies. We don't have enough postdocs and internships for psychologists. And so as a matter of course, if you are trying to become one of those professionals, you very likely have to leave Oklahoma. And then the data will show that where you do your postdoc or your residency is likely where you will stay in practice. So we are shipping our people out to other states instead of meeting the dire need that is here. So we have a $36.8 million appropriation request before the state legislature this session to strengthen the training post-graduation for these professionals.
So, I mean, you're describing a real bottleneck. So people are getting the degrees necessary and then finding this lack of almost like a pyramid or something, like where it narrows. And so they don't have training opportunities. I wanted to make one optimistic sort of side comment on what you just said, which is I work with the Medicare population. So I'm governed really by what's called CMS, the Center for Medicare and Medicaid Services. And as of January 1st this year, they made a change where we at Oak Street Health, we practice a collaborative care model. So we have behavioral health specialists that are usually licensed clinical social workers in our centers. And this year we've expanded, or Medicare has allowed us to expand the credential to LMFTs, which are licensed marriage and family therapists, as well as LPCs, licensed practical counselors. So it is one way we've expanded the sort of the opportunity for both training and for practitioners. I wanted to circle back. Dr. Coffey, you mentioned in talking about wellness at OSU, a sense of belonging. I wanted to actually shift back to Aisha for a second, because that was a theme that you echoed at Quick Trip. And one of the ways you're such a highly valued company and corporate partner is, again, the level to which your employees think of Quick Trip as a great place to work. And so talk for a little bit, if you can, about sense of belonging at Quick Trip, how you achieve that and measure it.
So our culture at Quick Trip is to provide an opportunity for our employees to grow and succeed. And we do surveys annually, and every year it comes back that our employees always feel a sense of belonging, like they belong. I can attest to that. I always feel like I've belonged since I was a part-time clerk, and coming up through the chains here at Quick Trip, it's just always been a thing where Quick Trip is like a family. It's not like a job. You wake up every morning, you're like, hey, let me go see my actual extended family, and that's work for you.
I mean, that's amazing, because I think any company worth its weight in anything would want to feel like a family. So is there any like secret sauce the Quick Trip has that seriously, like that's an amazing quality.
I think it starts with leadership. Our CEO, he has so much passion. He treats us like family. And I think that's where it starts. It always starts at the top and it kind of trickles down. People don't quit their jobs, they quit their bosses. And that's a true statement. And I've always believed in that.
Huh. That's so okay. Thank you. Well, and I'm curious too, like circling back to Zach's comments, how does Quick Trip, you mentioned sort of the self-funded health program, I think you call it Quick Med, that employees have access to. Does Quick Trip sort of advocate at like at a policy level, whether it's local, state, or federal, for whether it's mental health benefits, or what kinds of advocacy is Quick Trip doing?
So right now, we're working on a program where we're partnering in our communities to give back philanthropic dollars to ensure that all of our employees and customers feel like they're safe, they're stable, and our communities are stronger because we're investing our dollars into our communities and into all of our community partners.
And so, I mean, there's kind of a full circle effect of like there's somewhat of a sort of mental health problem, if you will, like it's some Quick Trip locations, not everywhere, but where you have people with probably serious mental illness who are kind of hanging out or are homeless or things like that. I mean, and so it's an issue for you like doing business. So you're advocating in a sense for a better safety net, if you will. Is that safe to say?
Yeah, absolutely. So it's a societal problem. And what we're doing as an organization, we're taking that first step. And like I said, we're putting those philanthropic dollars into the communities, into those organizations to help us, hey, help the homeless, help someone that has a substance abuse problem, help someone that, does violent crime. So we're working with police officers in our communities. We're working with organizations to place the homeless into homes. We're working with organizations that actually help with substance abuse. So we're doing our part to, step up and be leaders in the community as an organization and put money towards that. So, again, our stores, our employees can be safer, stronger, and more, just there for our communities.
Nice.
Mm-hmm.
Sarah, I wanted to ask you to sort of talk, if you will, about both the combination, if you will, of like workplace mental health. I've already asked you about that in terms of your faculty and your students and residents, but give you a second, if you will, to plug like what's going on in Tulsa vis-a-vis OSU, the Veterans Administration, and mental health facilities in a sort of a burgeoning kind of opportunity for mental health practitioners and serving our community downtown.
Yeah, no, I think that's great. And as you were mentioning that, John, I was thinking about, we're kind of coming here talking about this pre-COVID and the workplace mental health, and we're touching on the importance of belonging. I think when many of us had to kind of focus to more virtual settings and weren't able to be in the office, that's one thing I think we missed, was that experience of belonging. And I think many of us are trying to kind of figure out what this new normal is for us. Are we wanting to do virtual? Are we needing to have more flexible work? Kind of what is our wellness kind of protocol for ourselves and what that looks like? And part of that probably is kind of through policies and things that we're doing in the workplace. Part of it might be your own individualized health plan, whether that be therapy or seeking out medication. Zach had mentioned too that the workforce shortage in Oklahoma is certainly a rate limiting step to having access to quality mental health. And that's something that at OSU we certainly take very seriously. I was kind of joking that this past 2 weeks, we have our medical students that they apply for a match. And so they put in their top choices of where they want to continue their training. Pardon me. And then they are able to kind of go through this match and they decide where they're going to go. And prior to the match, I had really heavily recruited and asked our administration to extend our residency from 6 slots per year to 8. And I was just telling them how important it was. And I was really nervous because March 15th, I was going to be very embarrassed if we didn't fill. If for the 8 slots, we only got 6. But I'm really excited to say that we have 8 residents that are wonderful. 4 of them are from Oklahoma State University, 4 from outside of Oklahoma that will be working with us. But the reality is that we need opportunities to care for patients across the continuum. So this means caring for patients in the outpatient setting, whether that be with a therapist or a psychiatrist or other clinicians, as well as whenever we need more acute levels of care. So just like you might need to go to the hospital because of, a heart attack or something else that's going on. No different. Do we have a psychiatric emergency that might require a more intensive level of care? And then the reality is that there really isn't enough care that's provided here in the Tulsa area. So this really speaks to the importance of partnerships. So we're really excited. We'll be opening the Oklahoma Psychiatric Care Center in downtown Tulsa alongside the VA. And our Oklahoma Psychiatric Care Center is a partnership with Oklahoma State University, with philanthropic donors, as well as the state. And I would just offer, kind of speaking to this too, that this is a community initiative, and we're stronger when we're together. Tulsa, I think, is so exemplary of this with our philanthropic support, with the business community support, as well as the state. It's exciting that we have this coming downtown. I'm excited that OSU will be a part of it to provide that quality of care, to get patients towards a pathway of recovery, so that they're able to do the great things that they want to do with their families, with their community, and all the richness of their life.
Does the downtown sort of burgeoning mental health care community, have there been projections of sort of the economic impact of that?
I think it's going to be pretty big, and Zach might know that. And that's a great question. But yeah, I think that that's really the intention. But as far as the number, I don't know. I might have to phone a friend on that, though.
Fair enough. Well, let's go to Zach
Yeah.
and see if you want to take that one. Or another one would be, the Healthy Minds Initiative is a nonprofit advocacy organization or backbone organization, as you mentioned. What opportunities or what awareness do you have in the business community when you think about employers or employee retention? Are there opportunities for businesses to collaborate with Healthy Minds?
Yeah, absolutely. Could I take a little bit of the previous
Sure,
question too?
please.
There is a documented economic impact to delivering mental health services, and that is not just because many therapists can make six figures now in the community mental health system, which is not a known fact, but it's certainly true. And then psychiatrists or doctors who are specialists, and they have good incomes as well. So economic impact from that. But then we see the deluge of lost productivity, of workforce participation that occurs when we fail to deliver appropriate mental health care. Oklahoma's labor participation rate is something like 40%. A significant chunk of the reason people do not work is with mental illness. And Dr. Coffey mentioned it earlier, the leading cause of disability ages 15 to 44 is mental health related. And so we've got to figure that out. But then if you are working due to absenteeism, you're likely to miss about 31 days a year from depression alone that is untreated, 28 days a year lost in presenteeism, meaning you're at your desk, you're working, and you're not really engaged in your work, and your turnover rates are high. There's immense economic impact from just that alone. If we can deliver mental health services to employees, for example, the research shows that about 80% of the time you experience more efficacy in your job, you like your job, you stay. Treatment works. And so, yes, big economic impact from those. And then the second question you had was how businesses can partner with Healthy Minds. And I have a unique perspective on this because I used to be a representative of the Tulsa Regional Chamber. I used to work there, and I worked with QuickTrip and other companies in the Tulsa region on this issue. And really what we see from the business community is a desire to improve workforce participation and economic development. We see a desire to have a better community. And so there's really not a lot that doesn't overlap with the issue of mental health. When you start realizing that, hey, the risk factors for developing a mental illness are lack of belonging, a sense of that you like your community, that your community is thriving, there's a high quality of life. These are sort of Chamber of Commerce-y type words, but they're also mental health aligned, because we've got to have this is, I think, where COVID really did us a disservice as a society, is it disconnected us. And disconnection and lack of belonging is one of the top risk factors for developing a mental health issue. And we have to really look at our future workforce in this conversation with children, because the median age of onset of a mental illness is 11, but typically by the age of about 16, 17, your mental illness is established. So what is happening to our youth is our future workforce. And this is where the business community needs to step up as an advocate and work with the legislature on solutions to mental health, to convey to the legislature that mental health and addiction solutions are a priority for the business community for all of these reasons. It is a workforce issue. It is an economic development issue. And that is the number one thing that we can do, because the business community has an outstanding voice and platform at the Capitol. They are listened to. And typically what we hear from the business community are not mental health. It's on those economic development side of things, which is great and fine. But to hear legislators say that Cox, I see Connor here, talk to them about the importance of mental health because of the issues facing their workforce, that sticks with legislators a lot more than it sticks when a social worker tells them that mental health is an issue. So just know that you have that bully pulpit and you really can influence that conversation.
That's a great message. I think even like a take-home message for our audience or our listeners today. So thank you for mentioning that, because the importance of, I learned that, I think, from you really by and large, is like at the state level, our legislators get so essentially so much less email, phone calls, et cetera, that like that one phone call can really make a difference, or that one piece of advocacy. I wanted to ask Aisha a question, because again, you brought up the theme of belonging, and our Surgeon General, Vivek Murthy, has written a book and talked about the priority, or made loneliness a priority, because many of our elders are, whether they're widowed, widowers, they're living lives of isolation, and we've talked about how the pandemic had that isolating effect. And so belonging at Quick Trip, or belonging by and large, is seen as such an important value. Another way that I think employees or people in general feel good is when they're able to help, or able to do good works in the community or with their families. Does Quick Trip incentivize like philanthropic work or volunteer time or things like that? Or is that something that you're able to do?
Absolutely. So we do offer volunteer time to all of our employees. Of course, we work with the communities, and we have so many different programs in all of our markets. We're in 17 markets. So each market is specific to that market, and we do days of caring in the communities. We're always, again, good neighbors in the community, and we're working in the communities. We look like our communities. So if we have organizations in our communities that we need to support and they follow our guidelines, we're there. We're there participating.
So yeah, and I've certainly seen Quick Trip's name, but participation in many civic types of endeavors around Tulsa, which I guess is headquarters. So this question has come up, I think, from our audience quite a bit, about sort of the value of nature, of participating in nature, just getting out and walking more. Corey kind of mentioned it in her opening comments, and it may not be something you can sort of control or recommend at Quick Trip, but I wanted to ask all of the panelists your thoughts on sort of like the value of getting out in nature or spending time outdoors, essentially. Any thoughts on that?
So at our corporate campus
Go.
here in Tulsa, of course, we have a large campus, and we have employees that, hey, sometimes go outside and they walk around the campus. It's a nice campus. We walk around, kind of taking the pond, the geese, all the things, all nature, all things nature. So you can go outside and walk around, take a break, lunch break. Sometimes people take a 15 minutes, because we deal with some pretty interesting things on a day-to-day basis. So not just our frontline employees, even our corporate employees. So
Wow.
our frontline employees, they can always go outside. When I was in the stores, I actually went outside, swept a lot if I had an encounter where it was kind of difficult, because
So it was
sometimes we deal with that.
You got outside in a way to defuse or to
Absolutely.
help. Interesting.
Mhm.
It was
Go outside and
yeah.
sweep the lot, and you see customers that are, know you by name, and you know them by name. So again, good neighbors in the community. You're like, hey, how you doing? It's like, how's your day going? It was bad, but now it's great now that I see your smiling face. So it's one where you're always outside. You can engage with other customers, with the community. You're outside at our corporate office. We're walking around kind of with another coworker and just exercising, getting out there.
Let me ask Dr. Coffey about that in terms of just, I don't know, research studies on the value. I mean, I've when in the role Corey mentioned at the radio, we got sent a couple of times books about this activity called forest bathing. Anyone familiar with that? So, okay, a few hands. So like really just getting out of nature and really like being out in the forest and kind of like absorbing the nature, like quite like literally, figuratively, physically. Thoughts?
Yeah, so I mean, I would agree. I think there is a lot of research that supports the importance of that. And even just, we can all be our own kind of scientist here, right? I mean, humans weren't really intended to be sitting in front of a screen for 8 hours a day without movement. I don't know if any of you guys were made that way. But again, there's something about the visual stimulation that's coming to us that gets very monotonous there. So being out in nature and kind of seeing the trees, it does something to us. I think I've seen studies too that just kind of taking off your shoes and planting your foot in the ground actually raises serotonin levels in your body too, which is a very important chemical that we think about with anxiety and depression. But I encourage all of us to kind of be our own science experiment and see what works best for us too. We know that exercise is very important, not only for physical health, but mental health as well. It really helps to raise a lot of those kind of feel-good hormones that help us to feel better. And there's a lovely book called The Last Child in the Woods that talks about the importance of this with children as well. The reality is that we have a lot of new technology and things that allow us to be ever on and always kind of sitting in front of something, kind of constantly feeding us information. But really, we're deprived quite a bit of that natural experience. And again, the lovely thing about Tulsa is that we have the Gathering Place, we have Turkey Mountain, we have so many wonderful spaces that we can get out in. It's really important. And I think, you know, as a child psychiatrist, I certainly think this is important for children, but guess what? I think we're all just kind of big kids. And I think it's good to get outside and be in that fresh air and to really enjoy the environment. What Corey was talking to, I think in Canada, I don't see this quite a bit in the United States, but physicians are actually writing prescriptions to go out. I think there was a thing about writing a prescription for national park activities as well. And so it's certainly something the medical community is recognizing and would highly recommend us getting out in nature whenever we're able to.
Thank you. You nailed it well, but we had a question from the audience about what's being called nature deficit disorder. So that would be and I'll just read the question here. Children that do not have access to nature tend to have an increased challenges in problem solving, increased behavioral issues or anxiety, and they will be our workforce. So the questioner wanted to know if you would address if your employees have family mental health programs. Or specifically, you could talk about children, and I don't know if Healthy Minds is doing advocacy specifically around children's mental health too.
Yeah, I mean, and I might speak to that too. I think
Sure.
I love the aspect of family mental health programs because as a parent myself, with two small children as well, certainly recognize the role of me as a caregiver and setting the example, as well as making sure that family members are aware that they have permission to kind of take away the technological device and other things as well. I feel like when people are bringing their children to my clinic, it's always feeling like, well, I can't take away their iPad. I can't take away their phone. They use it so often. And I often tell them there might be a little bit of a pushback, but kids are really adept at kind of finding other ways to care for themselves if they don't have access to it. But we also have to recognize the kind of, I don't know, default of being human, right? Where it's like, if I have something that will easily entertain me, I'm probably going to go to that. We can't accept kids to kind of not go to that because it's always there and it feels very stimulating and good. But if we can set examples and kind of have time outside, being outside, I think that's really important too for our families. But it really does come from us as the caregivers, making sure that we are prioritizing that in our own communities.
Thank you. Yeah, you should go.
At Quick Trip, we provide 5 free sessions, not just for the employees, but the families as well. So it's not just for the specific employee, but everyone that's under your benefits plan gets those 5 free sessions based on diagnosis. So if it's one specific thing, it can be another specific thing. That's another 5 free sessions.
Wow.
And yes, we communicate that to our employees and to our families so they know you can go and get those therapy sessions if it's needed and necessary.
It's probably worth pointing out, it may be self-evident, although not everyone may know, but like an employee assistance program is like, it's outside of the company, so it's completely confidential and it's like, right, so there's HIPAA protected and it's, in other words, the company isn't going to really know about it.
Right.
Yeah, okay.
Absolutely.
I just wanted to make that clear. And so I wanted, this is a good opportunity to segue back to Zach for a second, because some of the work you did last session was really interesting. So I wanted to highlight again the contrast. So Quick Trip has this self-funded program that allows beneficiaries, allows employees to use healthcare, both in this Quick Med or in the employee assistance program. But if you aren't working at a company that like really treats its employees well, you're on, it's different if you're on public assistance, but if you're working at a company where there's a high deductible or a high copay, it's harder to access those mental health services. And the Healthy Minds Initiative did some really interesting work last session, and I think wrote a white paper on what like so-called ghost networks. Just share it with our audience because it's so interesting and kind of befuddling and sad, really.
I certainly can. Do you mind if I briefly touch on the nature?
I would love
piece
it
as
if you
well, because I know Corey will ask me specifically to do that as well. But I think with the nature conversation, we're really talking about self-care, and nature is a really common way that you can get self-care. And there's certainly a correlation. We see that actually you have a significantly higher chance of experiencing psychosis at some point of your life if you lived in an urban area. So there's some really interesting research about that. And psychosis is sort of a break between what is real and what is not real that can really affect anyone, although there are certainly risk factors for some. But anyway, I think for the company, because this is a B2B, from a company executive perspective, yes, we need to encourage our employees to get self-care. We also need to model it. And I need to stress this because it is not enough to send out an email or say in a staff meeting, I hope you get self-care, take a mental health day. That is not enough. Our employees want to achieve, they want to perform, and there is often an implicit culture at the company that if you don't achieve at a very high level, you won't get promotion opportunities and things like that. We have to be really active from the executive level in both modeling, meaning the executives need to take their mental health days. The executives need to be seen walking through the company garden or whatever you have. They need to talk about these things so that the employees really know, okay, this is really actually not only allowed, but it is anticipated and expected. And some companies actually do a mandatory mental health day that doesn't even count against your sick time or anything like that. Again, why would you do this as a company? Because you're taking people away from your desks and productivity? No, you are increasing productivity. Productivity goes up when you take care of yourself substantially, and the data certainly support that. So I just wanted to say that piece of it.
Sorry, just right on that, one of you, or maybe all of you, could talk to the cost of like replacing an employee versus, right?
It's at least 33% of an annual salary, but there's certainly different ways to measure that. Yeah, so if you would, I could get into the other issue that you asked about. Dr. Schuman was asking about the availability of providers through your insurance network, which is a really key issue because 2 million Oklahomans primarily receive their healthcare through private insurance plans. And if you are an employer-sponsored plan or you are employed in some way, this is likely how you're getting your healthcare, rather through not through Medicaid or Medicare. And this is critically important because it's 2/3 of the state. And we often ignore this part of the conversation. And what we found is that throughout the sort of the years preceding the formation of Healthy Minds, the sort of anecdote is I can't get in to see a therapist. I call my provider, they can't get me in. But you go round and round, it takes months and months and months. Maybe it's because we have a workforce shortage. Yes, we have a workforce shortage. However, Healthy Minds, being the data-driven organization that we are, actually acquired the 5 largest health plans networks, the list of providers that they would give you or I to say, these are the providers, the mental health providers you can call because they are in network, meaning the insurer will pay the largest share of that cost. And we called those providers in 9 representative zip codes, urban, suburban, and rural throughout the state. And we found very shocking results. We found that 65% of the time, the provider was unreachable. It was a disconnected phone line. The person who answered the phone said that provider is no longer here or is deceased, which is where the moniker Ghost Network comes from. And for the 35% of providers who actually did answer the phone, 18% of them said, we're not actually in that plan, or we don't think we are. And then for those who could try to schedule you something, the majority of them couldn't schedule you in any time that would be an evidence-based amount of time before you would need mental health care. You're often waiting a month or more. This is the issue. This is the situation that our employees are facing, is they are calling the networks that you as employers pay for. But what you don't realize is that your insurance company sold you a car that doesn't work, nor do they even know if the car works. These provider networks are not adequate, and it is a travesty and is hurting people. People are dying. This is how the industries, our businesses and companies in the state really can advocate for their employees, is to advocate at their insurance level with your plan manager. Show me your work. Are you complying with mental health parity, which says that you can have no greater barriers to seeking mental health care as you do physical health care? Spoiler alert, there are greater barriers to seeking mental health care than there are physical health care. And that is actually illegal based on legislation President Bush signed in 2008 that we still haven't figured out as a nation or as a state. But in Oklahoma, what we have to realize is that the best plan in the state covers only about 30%, I think is the number, 30% of the licensed and credentialed behavioral health providers in the state. So while we do have a workforce shortage, don't ever let anyone tell you that that's the problem with insurance networks. There are providers that can be credentialed as a network provider. Why are they not credentialed? Because the data tell us that insurance pays about 27% less for similar billing codes on the mental health side as they do for, quote, physical healthcare providers. The stigma associated with mental health care has absolutely affected how we fund mental health services at the private insurer level. And the problem is When you delay mental health care, which is the result of all of this, it is more expensive on the health insurance payer. It is more expensive on the employer, and it is worse for society and our communities. I can't stress enough how important this issue is, that we really have to figure it out.
Thank you. And Zach, what's the word for that 2008 President Bush thing where we're supposed to equate mental and physical health?
I always get it wrong. It's the Mental Health Addiction and Equity. No, I'm sorry.
Oh.
The Mental Health Addiction and Equity Parity Act, something
Parity.
like that.
That was, I just wanted to.
But parity is the moniker.
I was a take home for our audience, parity. There's that concept of mental health parity. I just wanted to highlight that. Okay, some good audience questions here. So question for the panel. How can managers support staff who are experiencing mental health issues? Signs to look out for? What policies in the workplace have been shown to be helpful? And maybe that's for Aisha, since you are directly, but for any of you, really.
So for us, our frontline employees, for instance, if we have an event at one of our stores and it's traumatic, we pull our employees to the side, and that's where we engage in conversation, ensuring their mental health is in a good state. If not, that's where we go in and offer the employee assistance program, and we tell them, hey, you can get that time off. We give them time off in those instances if they've been in a tragic or traumatic event. So we support our employees because our employees make the place.
So is there always a debrief after an event, like a traumatic event?
Yes,
Always. Okay.
always.
That's amazing. And so is the store manager empowered to be the one to say like, hey, we're gonna huddle and we're gonna, talk this through. And if anyone is struggling, like here are the resources.
Right. So it's the supervisor comes in because we immediately have to go to the store location once something happens like that. And we do huddle up all of our employees, talk to them, do a debriefing, check in with their mental health, make sure they feel okay. If they're not okay finishing their shift, we'll replace them. We'll tell them to go home, get someone else in to work their shift, and ensure that they get the mental health help that they need.
So sometimes with mental health, there can either be like a delayed response or part of the problem, maybe people can't communicate it or don't really know what they're feeling. So like it could be delayed. I guess, are there signs you just essentially you instruct or coach managers or supervisors to look out for someone who might be exhibiting low mood or emotional lability as it's known, or just, is that I don't know, I'm speculating here. I don't know.
I think our managers kind of can identify when something changes with an employee. I was a store manager, and you can tell a difference if we're experiencing a shift in behavior in an employee. And that's when you have your conversations. We always have one-on-ones with our employees and have those conversations. Hey, what's going on? Do you have anything going on at home? Is anything different from the event that happened at the store? And from there, again, you have that EAP program that they can go. 5 free sessions. It doesn't matter how many different events happen, whether it's at home, whether it's at work. They have that opportunity to go back in and have those 5 free sessions. It does not stop at one isolated event.
I guess I wanted to personally highlight, the 5 free sessions for our audience, it could sound like, oh, like that's great, or like that's so many, or like, oh, only 5. And I think what I want to emphasize is like just the ability to have that in an easy and resourceful way that doesn't involve a runaround, a cul-de-sac, a dead end, an obstacle like Zach was mentioning, where it's actually accessible and that it's, it's time limited. So 5 sessions could be over 5 months. It could be over a few weeks. Just getting it done is like half the battle, or getting the appointment. So 5 might sound like not enough, but for cognitive behavioral therapy, or it can be very effective. And then of course you said, if someone develops something else, they can obviously get more care. So I just think I want to commend you on that. That's really good. And yeah, go for it. Yeah, please.
Just to provide some practical thoughts too, I guess.
Thank you.
So one thing I might ask of this group. So if you were at a restaurant and if you saw somebody choking, what would you do? oh gosh, guys, you got to get better than that, right? Like we might panic, right? But probably somebody would go and do the Heimlich maneuver, right? We kind of know what to do whenever there's an emergency, with a physical emergency. And I think what often gets in the way too sometimes, because many of us are not trained licensed mental health professionals, right? If we don't necessarily know the signs and symptoms to look out for. I love the comment about the one-on-one and checking in on the relationship. I think that's so important. And to make sure that we're starting there, making sure we're checking in with people, how they're doing emotionally, how are things going? Have you taken a vacation? What are you doing to kind of help to support yourself? But also recognizing too that there's actually many organizations that have additional evidence-based training for organizations like this. So the National Council for Mental Wellbeing actually offers mental health first aid, which is kind of similar. If any of you all have ever done first aid where you learn how to do the Heimlich maneuver and perhaps CPR, we have things like this available in Oklahoma. OSU, my shop, actually offers mental health first aid training. There's actually QPR, which is question, persuade, and refer, which is through the American Psychiatric Association. And I'll pass it off to Zach too, because Oklahoma has its own training initiative through the Department of Mental Health that can be available for employees. So that if you are concerned about somebody, because quite often, even if we're concerned, if we don't know what to do with it, we might not touch it, right? And so we need to make sure that we're educating the workforce and our community to know what to do, so that they can refer. And then the other thing I would just add too is that we now have 988, which is our psychiatric emergency line. And so if you are really concerned about a colleague or a friend or a community member that they might have a psychiatric emergency, you can call that number and get some support. You can even text that number to get some support, because just like there are medical emergencies and physical health emergencies, there are psychiatric emergencies too. And we just haven't done the best job of educating each other about how we can do that. And I'll let Zach talk about DMH's initiative.
Yeah, thank you, Dr. Coffey, and highly recommend mental health first aid for really your entire workforce, if not at least the managers, but your entire workforce ideally. A less intensive, because that's an 8-hour plus training, which I know is hard. A less intensive option would be the Department of Mental Health and Substance Abuse Services in Oklahoma. Our state mental health agency offers a virtual training for managers called Are You Okay? That would be a good option to require your management staff or anybody who manages people to take. You can find that, really just search Are You Okay Oklahoma Mental Health, and it'll pop up. I would also say that there are a ton of resources online for employers. I know some of this is pretty technical and difficult, especially if you're talking about negotiating with an insurance company, like I mentioned before. There are resources at the American Psychiatric Association, NAMI. What we've done at Healthy Minds, if you want to search our website for workplace wellness or go to our booth out here, we've got some stuff printed out. We've compiled resources that are available to employers. We didn't generate the resources, we're just giving you the list of where to go, but that is also helpful.
Thank you. A lot of good questions from the audience, but we're nearing like the end of our time. But here's a pretty focused one on Quick Trip. So I guess I'll ask you. I mean, this might be a tough one, but it's to Aisha Jefferson. Why do you think Quick Trip is a draw for homeless or with serious mental health issues, like that mental health folks afflicted with mental health issues gravitate toward Quick Trip? For example, 11th and Utica, or Denver or Peoria Pine, like versus say McDonald's, which is that true that like homeless or mentally ill people don't gravitate toward McDonald's? I don't know, but is it just because Quick Trip is really like seen as a community resource and a friendly organization, or I mean, and maybe you don't, you brutalize people or, who are there that are, but do you have any insight on that? I don't know.
I think it's a societal problem. I don't think it's a Quick Trip base problem. Yes, some of our locations do, have homeless people on the outside, and that's because they probably see people there and they see people that they can ask things for, just as they would be at a McDonald's or any other location, because it's not just at Quick Trip.
It's definitely not.
It's not just a Quick Trip, but we do try to work with our community leaders and organizations where they come out and they kind of, bust them up, house them, and help them get into programs that can help them get out of these situations. So,
yes, please.
And I wanted to step in here in Quick Trip's defense a little bit as a representative of Mayor G.T. Bynum's task force on housing, mental health, and homelessness. And I can tell you it's certainly not a Quick Trip problem. It is a societal problem. And really, people experiencing homelessness are all over our communities. The issue is if they're back in the woods or they're behind some sort of they're just not in view. And the issue, when they come in view, people think suddenly it's a problem. Well, there's a couple of things here. Mental health is not a solution to homelessness. I need you to understand that housing is the solution to homelessness. Yes, people need mental health services. Yes, being homeless is a traumatic experience and is more likely to increase any one of us would be depressed if we lost our house. Okay, we need to understand that. Number two is people experiencing homelessness or people experiencing mental health issues are not dangerous by and large. In fact, the general public is far more dangerous. As a person experiencing a mental health issue, you are much more likely to be a victim of a violent crime than you are to perpetrate a violent crime. This is a stigma issue that is preventing us from really reaching out and caring for our neighbors and ensuring that they get the support they need. We cannot simply move people experiencing homelessness and expect the issue to go away. They will just move somewhere else. We need to solve the issue. And there are lots of ways that we can do that. But I know we're nearing time.
I think that's a great final takeaway point from you, and I'll ask our other panelists, but I wanted to just highlight, you talked about advocacy, you talked about calling legislators or taking activity, you talked about mental health first aid, among many other things. So you were a great addition to the panel. So thank you very much. Zach Stoikoff, founding executive director of a Healthy Minds Initiative. Dr. Sarah Coffey, any final thoughts?
Yeah, just again, thank you to the Sustainability Alliance for bringing this out in the open. I think continue to talk about this with your family, with your neighbors, with your community, because stigma really does drive a lot of the issues that we're seeing. And I think the more that we can talk candidly to be able to provide support for each other, it's just going to be so important. So thank you all for taking the time to be here today, and let's keep the conversation going. Thank you.
Yeah, so Dr. Sarah Coffey, the current chair of psychiatry and mental health, behavioral health at Oklahoma State University Center for Health Sciences. Aisha Jefferson, final words.
Yes. Well, thank you all for coming today and listening to our story at Quick Trip. Our people make the place, and they come in every day and they work hard, and our culture is to provide an opportunity for our employees to grow and be successful, and we support that 100%. So we want to ensure that we're good neighbors in the community, and we provide those opportunities for our employees to have that support, to feel like they belong, and to be smiling and saying hello when you guys walk through that door. So thank you guys for hearing our side of, mental health and retention and keeping our employees happy. And hey, 21 years, that's a long time to be with one place and just feel happy every time you wake up and go to work every day. So thank you guys for
Yeah,
this
thank you for
opportunity.
sharing. Aisha Jefferson's corporate communications manager at the Quick Trip Corporation. How about a round of applause for our panelists today? They were tremendous. Thank you guys very much. I'm going to turn things over to Sunny, who's the development director at the Sustainability Alliance. And I thank you all for your great questions and great attention on today's topic.
All right, let's give a great round of applause to our panelists and to our moderator. Thank you so much to everyone who was here today. Well, first and foremost, thank you very much for welcoming me into the Sustainability Alliance. Just a little over 1 month that I've been there, and it's a great place to work. We get plenty of time to go outside in nature with the nature of our job. So a big thank you to Corey for allowing us to do those types of things that keep us in a good place mentally and physically. But we do want to say a big thank you to our sponsors today, to Dewberry and to OSU. Please give them a big round of applause for making this happen. And if you are interested in becoming a B2B member, please see me afterwards. I would love to speak with you more about it. We have some great things coming up with the Sustainability Alliance, including our Recharge. It's our big fundraiser and a big fun event. This year's theme is Roots and Boots. It's a chance to dig those boots out of the back of your closet, put them on, and come outside and have a great time. That's going to be coming up in September. So thank you so much. Again, we'd like to say a big thank you to our gracious hosts. We appreciate your time, John, Aisha, Sarah, Zach. Thank you so much. And again, if you're interested in joining our scorecard program, if you work for a large business or even a small business, we can tailor it, adjust it to your needs. Please see Morgan in the back there and come by our booth for more information. Now, our next event is this is going to be Thursday, April 4th. It is our next first Thursday. That one's going to be a great time. And also May 2nd, Thursday, it's our next Green Drinks. And that's a great time to network. It's a social hour, so you can meet some of our members and network with other people who are like-minded individuals, or maybe it's somebody you've never met before. It's your opportunity to come by and enjoy a nice drink and the social hour. The next B2B Case for Sustainability series is May 9th. This one is in Oklahoma City. We're going to have a conversation
with Oklahoma Secretary of Energy and the Environment, Secretary Ken McQueen. He will be discussing current goals and activities of the Secretary's office. Now, Secretary McQueen will be giving an update to the business community on EPA funding opportunities and upcoming rules and how they may affect your business. And you can join us today and support the B2B memberships. It's $250 annually, and it comes with a free entry to all of our B2B events, brand recognition on our website and event materials, and the ability to host booths like the ones that you have seen here today. Use the QR code on your screen to explore membership options for both organizations and individuals. This is not open just to businesses. We would love to have you as an individual member as well. Recharge, save the date. Make sure you talk to me more about that if you're interested in attending. And we have some gifts for our panelists and for our moderator today. Dr. Sarah Coffey's book, Unpacked. It's going to be coming out very, very soon in May, and we did not know that Dr. Coffey was going to bring some of the copies with her today. So we bought some online. They'll be delivered in just a few days, but we actually have physical copies to give to all of our panelists today. And for Dr. Coffey, we have the Nature Fix by Florence Williams, and we also have cookies for all of you from Altamont Bakery, who supports individuals with mental illness through baking. So a big thank you to everyone for attending. Thank you again to our sponsors. You're welcome to stick around and have some snacks and coffee and network for as long as you like. A big thank you to all of you today. Thank you so much.